Every 3 seconds, someone in the Americas needs blood. Someone's mother, or neighbor, or friend. Of the hundreds of thousands of units of blood used each day, most is given by people for people they do not know. Michelle Friedhofer is one such blood donor.
How many times did I donate? Around 50, I guess.
Michelle Friedhofer is one of a growing number of people who give their safe blood to a blood bank for use by anyone who needs it.
Why do I donate blood? Because there are people in need of it. I find it funny when I tell my friends that I've donated blood. They always think about my family and other friends and ask me if someone is needing blood. I say yes, and they ask who. I say I don't know, but I'm sure someone does need it now.
One blood donation, approximately 1 pint, can be separated into 3 components: red blood cells, platelets, and plasma. Red blood cells carry oxygen through the blood and are given mostly to trauma, heart surgery, and transplant patients. Red blood cells can be used up to 42 days from the day of donation. Platelets help the blood to clot. They're given to patients with bleeding disorders. They're also needed by cancer patients undergoing chemotherapy, which destroys the body's blood cells. Platelets must be used within 5 days. Frozen, it will keep and can be used within a year.
The thing that motivated me to donate blood is that I've always been interested in medicine. I even went to medical school for a while. I have seen people in need. I have seen children suffering. People who could have survived if blood had been available. I enjoy donating blood. I enjoy helping others.
The mission of blood banks is the efficient and timely preparation of safe blood products. Ministries of health must have an understanding of the blood collection process and must exercise a steering role in the establishment of standards and practices. The blood donation system should follow 5 layers of safety procedures. The first is the establishment of blood donor eligibility standards, because the safety of blood products depends primarily on the quality of the blood donors. Healthy means that a donor must be free of major cold, flu, and allergy symptoms. They can't have had hepatitis. And they can't have had any risk factors or risk behaviors associated with HIV or AIDS. Each potential donor is interviewed in an individual screening process. Giving a detailed health history protects the health of both the potential donor and the recipient. When there is a health risk, the potential donor is deferred and asked not to give blood. It is generally accepted that volunteers who donate blood repeatedly are the safest in comparison to people who give blood for a particular patient or for remuneration. The seller's usual low socioeconomic status is, in itself, a risk factor for acquiring infections that can be transmitted through transfusions. Furthermore, when the motivation is economic, potential donors may lie, denying risk behaviors during the pre-donation interview. The next step is a brief physical examination that includes checking the donor's blood pressure, pulse, and temperature. A few drops of blood are taken from a finger or an earlobe to test the iron content and to determine the donor's blood type. Abnormalities found in any part of the physical exam may be cause for a deferral. In an emergency, anyone can receive type O red blood cells, which is why people with type O blood are referred to as universal donors. The donation itself normally takes less than 10 minutes. The donor's arm is sterilized. Then a new, sterile needle is inserted into the vein at the elbow joint. Squeezing the hand into a fist and relaxing helps blood flow from the vein into the blood bag. Blood cannot be manufactured except by the human body. Donors are the only source of this precious resource. The average adult has 10 to 12 pints of blood. The donor's body replenishes the fluid lost from donation within 24 hours. After donating, the body replaces the plasma in just 72 hours. and the other components within a few weeks. Once donated, the fragile blood is sent to a laboratory for testing. Rigorous controls are required in all regulated labs. The screening tests are designed to detect as many infections as possible. Because these tests are so sensitive, some donors may have a false positive result, even if they were never exposed to a particular infection. In order to sort out true infections from false positive test results, screening tests may be followed up with more specific tests called confirmatory tests. Blood testing is no place to cut corners. Maintaining the sterility of the blood is critical. Compromises in testing or processing jeopardize a nation's entire blood supply, and hence a nation's health. For example, sometimes labs pool several samples when testing for HCV to offset the cost of laboratory reagents. This practice affects the sensitivity of the tests and should be eliminated. In addition to screenings for disease, there are also confidential exclusion of donations and donor record checks. Throughout the Americas, accepted good manufacturing practices are being upgraded with new quality control programs. These standards should include external performance evaluation, quality control measures, and audits. Current law in all the countries in Latin America, except for El Salvador and Nicaragua, ensures that the ministries of health regulate blood bank operations and recognizes voluntary donation as the best means for maintaining each nation's blood supply. The Pan American Health Organization is dedicated to working with the ministries to strengthen the quality of blood banks in the region of the Americas. In Latin America, efforts should be made to reduce the number of blood screening centers and thus enhance the consistent quality of the blood supply. Blood banks that analyze blood units should be chosen on the basis of location, accessibility, and infrastructure. A strict protocol should be established to ensure the safe, timely shipment of samples, the traceability of incoming specimens, and the accurate communication of results. Governments must supply financial and technical support to blood banks for accurate external performance evaluations. Quality assurance should be completely independent from operational functions, and the responsible institution should be given the authority to enforce remedial measures. But the bottom line of a country's safe blood supply continues to be safe blood donors. Donation areas should be accessible, comfortable, and safe. They should permit confidentiality, and they should operate on a donor-friendly schedule. The common practice of requiring replacement donors should be eliminated. This practice encourages many safe donors to give blood perhaps only once, and only when they know the recipient. Healthcare workers and other personnel need to understand their responsibility toward the donor and their role in maintaining the donor's privacy. Finally, it is vital to determine how blood and its products are used in clinical settings. The misuse and abuse of transfusion, for what often amounts to cosmetic or placebo reasons, contributes to elevated costs and lowered supplies of blood. The Pan American Health Organization has resources allocated for technical cooperation with its member countries. This office plans, implements, and evaluates activities to strengthen the region's blood banks. Ultimately, the greatest challenge for the promotion of voluntary blood donation are the services that care for potential donors in blood banks and mass communication. This grandmother saved the life of a young mother she didn't know. This executive helped an injured truck driver he never met. This construction worker gave a stranger's baby the chance for a good life. How? By donating their safe blood. 1 unit of your blood can help restore life and good health, and make someone else feel special. You. A message from the Pan American Health Organization. Voluntary, non-remunerated blood donation. Universal screening of donated blood. Quality control of blood processing. appropriate use of blood. A safe blood supply fuels the heartbeat of a nation.